All right, this is now part 2 of schizophrenia, and in part 2 we're going to look at causes and treatment. The understanding of schizophrenia has been approached from each of the major theoretical perspectives. Now, although the underlying cause of schizophrenia has not been identified, they are presumed to involve biological abnormalities in combination with psychological and environmental influences. As for treatment, there's no cure for schizophrenia. Treatment as well is multifaceted, usually involving antipsychotic medication and other psychological and rehabilitative processes. Now, hopefully the videos that I posted for the journal will help understand the range and the affect of schizophrenia, that not everyone is a, for lack of a better word, raging lunatic, that in fact with proper treatment many people can live very productive, even relatively normal existences and normal lives. So let's carry on with this, and one more week after this, everybody. We're almost there. Way to go. Bye now. The first theoretical perspective we're going to look at is psychodynamic perspective. And in the traditional psychodynamic model, schizophrenia represents a regression to the psychological state corresponding to early infancy, in which the proddings of the id produce bizarre, socially deviant behavior and give us, rise to what we know as hallucinations and delusions. Now, Harry Stack Sullivan, he considered the mother-child relationship and the anxious, hostile interactions that could occur in that relationship to be an explanation for schizophrenia. Now, it's somewhat controversial because it used to be historically a lot of theories around psychological disorders were based on the myth that parents and the way they raise their kids influence the psychological disorder, when in fact it may play a role, but it certainly isn't a cause. Learning theorists proposed that some form of schizophrenic behavior may result from a lack of social reinforcement, which leads to a gradual detachment from the social environment and increased attention to an inner world of fantasy. In addition, modeling and selective reinforcement of bizarre behavior may explain some schizophrenic behavior in hospital settings. So by virtue of the kind of environment within hospital settings where they treat people with schizophrenia, much of what they may witness is a place for social learning and might get inadvertently reinforced because of the environment they're in. That is a psychiatric hospital. Biological theoretical perspectives, they look at a number of different features, including genetic factors. This is cross-fostering studies that would have been done. Research has demonstrated a strong linkage between biological factors and schizophrenia. Evidence for genetic factors comes from studies of family patterns of schizophrenia, twin studies, adoption studies, and you'll find these on figure 10.1 on page 236, just to sort of see the sort of research phenomenon that explains to some degree, or at least offers some explanation for a biological connection for schizophrenia. The mode of genetic transmission remains unknown, as some have high risk for schizophrenia and do not develop the disorder, while others do. And this can be due to an interplay of a number of different and multiple factors. Biochemical factors, well, there's dopamine theory, and this is an overactivity of dopamine centers, the sites where dopamine molecules can attach and lock in. People with schizophrenia tend to have more dopamine receptors or more sensitivity to dopamine. Neuroleptic drugs, which are often used, these drugs block dopamine receptors and reduce the effect of dopamine and the impulses giving rise to schizophrenic behavior. Now, viral infections is a consideration. However, there's not a lot of solid data for this support just yet. There's some work that's being done to look at not just the virus, but also other attacks on the immune system. brain abnormalities with the use of PET scans, EEGs, CTs, and MRIs have helped identify any abnormalities within the brain of people with schizophrenia. Now, if you notice the picture on the left where it says schizophrenic brain and healthy brain, what you're noticing are enlarged ventricles are one of the findings that are being found in what we see in people with schizophrenia in their brain and people who are normal. There's also suggested a loss of brain cells, partly because of enlarged ventricles. In addition, we will find the hippocampus and the amygdala, as these two structures are a part of our limbic system, and the system that regulates emotions and higher functions, and is often the case with psychological disorders. There are a few clear answers to explanations for them, so we just seem to carry on with our explanations. There isn't a formal cause that we can hang our hat on and say, absolutely, this is it. Now, one of the things that we still can look to as a way of giving us a broader understanding is what we know as our diathos stress model. Environmental factors also play a role in schizophrenia, and many researchers have adopted diathos stress model to account for this interaction between genetic predisposition, this is the diathos, and the environmental factors. Most researchers today believe that neurotransmitter dopamine plays a role in schizophrenia, especially in the more flagrant features of the disorder. Viral factors may also be involved, but no definitive proof of viral involvement at this point. Evidence of brain dysfunction and structural damage in schizophrenia is accumulating, but researchers are uncertain about causal pathways. And so looking at this, what's genetically, a foundation, and what are the things inside the environment that people live in that could, in collaboration with genetic material, bring about the result that we would call schizophrenia. And then, of course, the potential proactive, the more healthy our communication is within our family, the nurturing family environment, and low levels of stress in our lives might not bring about the diagnosis of schizophrenia. It might be something different or milder or maybe even non-existent. If we continue on with some of our theoretical perspectives, we can look at family theories, and some of it is around what they call a schizophrenetic mother. This is someone who is cold, aloof, overprotective, domineering, that can, and I'm hesitant to say cause, can influence, if you look at the diathos model again, whatever genetic predisposition there might be, this would be part of the environmental experience that would increase the likelihood that that genetic predisposition would emerge. The double-blind communication theory, this is, whatever the child does is essentially wrong. There's nothing that they do that's right, and even when it's right, it's somehow wrong. Now, family factors such as communication deviance, expressed emotion, may act as a source of stress that increases the risk of development or reoccurrence of schizophrenia among people with a genetic predisposition. And again, I emphasize this relates to the diathos stress model. Now, treatment, there's no cure for schizophrenia, and so treatment tends to be multifaceted, incorporating pharmacological, psychological, and rehabilitative approaches. Antipsychotic medication is not a cure, but it tends to stem the more flagrant aspects of the disorder and reduce the need for hospitalization and the risk of reoccurring episodes. Today, the most common neuroleptics include phenothiazine, chlorpromazine, this would be known as a product name, Lagetil, thorazidine or Meloril, trifluoperazine or Stelazine, fluorphenazine or, sorry, I'm moving this along here, there we go, fluorphenazine or Modatin, as well as haloperidol and Haldol as being the product name. They appear to block dopamine receptors in the brain, thus reducing the elevated dopamine levels which would affect hallucinations and delusions. Now, tardive dyskinesia. This is a major risk to the extended use of neuroleptics. Tardive dyskinesia is the involuntary movements of body parts, eye blinking, facial tics, lip smacking. From experienced people who have worked in the area of people with developmental needs and people with psychological disorders, this can also relate to or look like Tourette's syndrome. It's not. It's an overuse and not having regular checks to see what the therapeutic levels of the medication they're using, the neuroleptics they're using. The long-term effect of using them uncontrolled is tardive dyskinesia. Medication needs to be carefully managed, and with people suffering from schizophrenia, this can be really difficult to do. They don't show up at hospitals sometimes. They have difficult making meetings and seeing the value and not seeing it as somehow a conspiracy, if you will. Psychoanalytic approaches have not been shown to be very effective with schizophrenia treatment. Now, learning-based approaches have had some success. They use things such as token economy systems. Now, replace the child here in this graphic with person with schizophrenia. They start with no tokens and no access to the desirable items or activities. They engage in what are desirable behaviors or target behaviors. They are given the tokens for these demonstrations of target behaviors, and then they can trade their tokens in for more desirable activities. Now, this is not an uncommon experience. It's used for children, but in treatment for psychological disorders, in particular in this case schizophrenia, it seems to show some success. Also, the development of social skills training have achieved some successes increasing adaptive behavior among people with schizophrenia. The psychosocial rehabilitation approach, this helps people with schizophrenia to adapt more successfully to occupational and social roles in the community, self-help groups in more structured psychosocial rehab centers, learning self-reliant skills like cooking, shopping, using of the bus and taxis to get around have shown to be very effective in some cases as well. In conjunction with most any of the other treatments, you'll find family intervention programs help families cope with the burden of care and communicate more clearly and learn more helpful ways of relating to the patient. Now, what you're going to find, and I hope you've gotten a bit of a grasp for, that schizophrenia is one, it's not particularly common when you think in terms of percentages, 1%, but we know so little about what causes it, why does it occur, and how to treat it, that it makes it such a difficult and more challenging psychological disorder, particularly with the kind of effect it can have on people's lives. And it's a lifelong condition. So I hope this has been helpful. We're almost there, everybody. One more week, and then we have a final test, and then we're done for the semester. All right. Carry on and keep up the good work, everybody. Bye now.